Hey guys, this is Aaron Farmer here with mysugarfreejourney.com, and this has been a crazy time if you've been trying to follow all the recommendations for the COVID vaccine. And it appears that RFK and the American Academy of Pediatrics are in a war over how many 2-year-olds are going to get jabbed. So here's a quick rundown of the timeline. First, on March 27th, RFK put out a video on X where he says, quote, "I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule." Next, on August 18th, the American Academy of Pediatrics put out their guidance that, for the first time in history, differed sharply from the recommendations of the CDC. They said the AAP is strongly recommending COVID-19 shots for children ages 6 months to 2 years. Shots are also advised for older children if parents want their kids vaccinated. Next, Dr. Paul Offit, the co-inventor of the rotavirus vaccine, went on PBS NewsHour to say that RFK is engaging in conspiracy theories, and all the evidence points to the idea that the AAP is correct. Everyone should vaccinate their children after 6 months old for COVID-19. Now, RFK has ended the emergency use authorization for the COVID vaccine, and if you want one, you will need to consult with your doctor. You will no longer be able to get the vaccine from your local pharmacy. RFK has also pulled funding for future mRNA development, so any future breakthroughs on that will probably not be made with public funds. I don't know about you, but this is the kind of thing I really wanted RFK to use the power of the MAHA movement to do. The vaccines are still available to anyone who wants them, but now with the added step of visiting a doctor, maybe patients will get something closer to informed consent. Also, this is a move towards keeping vaccines out of the healthy, for whom there is very little risk of harm from COVID. Even 2-year-olds with no underlying conditions have very little to fear from COVID, and the potential harms from the vaccine are largely unknown. So if you're wondering, the CDC's 2025 list of underlying medical conditions that increase risk of severe COVID-19 include asthma, cancer, kidney disease, heart conditions, HIV, certain mental health deficiencies, physical inactivity, and smoking. So I'm not sure how many 2-year-olds have a history of smoking, but if you want the vaccine, that list of underlying medical conditions, especially the physical inactivity one, is so broad that virtually anyone can get the vaccine if they want it. What do you guys think of this? I'd love to know. Leave me a comment. You guys have a good day. This is Aaron with mysugarfreejourney.com.